Hello, this is Elise, and we're here to share our product Assure Results, which offers immediate and reassuring communication with your patients. This product is brought to you by Tareem, Sean, Elise, John, Dinesh, and Chance. Here is our business model canvas. For key partners, we think we need IT programmers who are needed to create the software. We decided that Epic is a common healthcare medical record, and so we would initially have it designed for Epic users. For startup, we need to understand how to integrate the Epic program. Other e-health record creators might be for future expansion into all electronic health records. We also have key partners of physician leaders to help us understand the true real-world need and functionality, and regulatory experts and advisors to understand the laws associated with this product. The key activities are problem-solving, software solutions for automated lab follow-up, production, research, and development software must be continually updated, flexible, and scalable. Our platform or network, we have to have a company website created for marketing, software acquisition, payment, and as a help resource for providers that do buy our product. Key resources we need are physical, virtual administrative hub, intellectual, ensure brand patents, copyrights, data considerations. Human, we need innovators, software developers, marketing, customer care, financial officer, revenue stream collection and accounting support, and we need to acquire investor support. Our value proposition is for primary care providers who are dissatisfied with time-consuming manual patient follow-up after clinical hours. Our product is an AI assistant software that provides automated patient-empowering solutions to abnormal lab values. Unlike existing clinician workflows that hinder optimal scope of practice, we have assembled a patient-facing interface to facilitate task shifting. Customer relationships. Primary care providers expect expert team to install, customize, and troubleshoot the system, and they expect updates years into the future. Our product must help providers maintain close relationships with their patients. The channels are text message, email, and secure encrypted messaging via the electronic medical record. And we need to gain adult primary care providers' preferences for method of communication to their patients. Our customer segments are primarily adult primary care providers from small and large practices as our startup customers. Expansion would be possible to occupational medicine, orthopedics, and oncologists. All providers who order many labs on an outpatient basis. Our patients, the segments are the worried well, those with medical issues who want a response to labs immediately, and those who are tech savvy, such as they have access to email or texting function on their phone. In terms of our cost structure, the initial outlay is $1 million for startup, for software development, consultants, software sales rep, and a price to develop the software. After that, we anticipate fixed monthly costs, so for sales staff, call center staff, installation staff, technical support, and then variable monthly costs, including advertising costs and sales and installation costs. Our revenue streams initially are the licensing and installation fees for adult primary care provider groups, and recurring, we would charge a monthly per user subscription fee of $50 to $100 per user. So that is our Assure Results business model canvas.
Okay, so on to our value proposition. With the use of artificial intelligence and automation, we want to give back some of the time you're spending contacting your patients so you can focus on the higher value tasks. Our product is designed to take your practice communication to the next level. Our software pairs with your EHR to automatically send test results to patients efficiently and securely. These results will come paired with AI-guided treatment and follow-up recommendations to help eliminate the need for you to contact these patients directly. We've also added closed-loop communication processes to verify patients' receipt and understanding of the information they're receiving. So no worrying or wondering if your patients are getting what they need.
To investigate our product, we completed 30 interviews to discover our customers and test our hypothesis. This is what we learned from adult primary care providers. Primary care doctors are overwhelmed with their in-basket, specifically lab results that require outreach to their patients, and that they will be interested in an AI solution for this time that it takes them to call their patients back. We observed a mostly high level of frustration, including 1 to 3 hours beyond the end of the workday for in-basket work. Low-level phone results or emails take up a significant amount of time for physicians, constituting about 60% of all labs for adult primary care providers.
I had done one with a primary care physician, as had many others in our group, and ultimately really learned that physicians do expect to engage in time-consuming phone conversations with patients still who have limited health literacy or digital health access. But interestingly, patients who are more tech savvy may inadvertently require more time from physicians to engage in lab results just because they have, real-time access to their charts.
Really a summary of 4 interviews I did with 4 adult primary care doctors. Interestingly, both of the younger patients seem more likely to accept an automated response system for normal or common abnormal labs, while both of the older physicians thought that this was just part of their job and that they preferred to make these calls themselves.
4 providers that generated large volumes of outpatient labs. I learned there was interest in our AI-assisted lab follow-up, but further research would be needed to explore communication options for hard-to-contact patients.
We also interviewed specialty providers. I interviewed an orthopedic doctor to find out if our product might be expandable to non-adult primary care physicians in future iterations. Orthopedists receive phone messages or spend part of their consult appointments reviewing non-value-added findings with patients who are concerned. We also interviewed patients. A mostly high level of frustration was what our patients reported to us with receiving lab results, but not being able to understand them.
In terms of a discussion with a patient, we learned that AI-assisted software can be empowering, but can also be perceived as detracting from a patient-physician relationship, especially when it comes to trusting the information that's given to you, which isn't directly delivered by a physician with whom a relationship already exists.
Interview I did with a 72-year-old patient with moderate healthcare needs. There's definitely some apprehension about whether or not she'd be able to use this technology. She definitely had a preference for direct in-person communication in case she had questions, learning that there's going to be challenges in adoption of this technology with an elderly population. And it may actually mean that this is not a product that's marketed to practices that specialize in geriatrics.
A 65-year-old male patient with moderate healthcare needs. I observed and learned this patient was agreeable, assuming the technology was well vetted and continued provider access was possible.
Finally, I interviewed a CFO for a large medical group. The CFO was definitely interested in this product and stated that the time of the providers and nurse is better spent on other activities, but that the cost of the system must be equal to or less than the cost of paying providers or nurses for doing manual work.
The other interviews I had done were with revenue cycle managers, and overall observed that CMS actually changes CPT codes every year, which need to be revisited every December. These CPT codes include pre-work, intro work, and post-work, but they have to occur on the same calendar date. And now Epic apparently allows you to track when and for how long physicians are logging back into Epic. So we learned really that with these recent CMS changes, MDM is really going to be what mainly matters for ambulatory billing, and more labs interpreted often equates to a higher level of MDM and potentially greater reimbursable time. But at the same time, physicians are incentivized to set up separate office visits with patients to discuss abnormal lab results in detail.
What we learned for administrators is we're really going to have to work to make sure we can prove out our quality perspective, and that we have a quantifiable amount of off-hour working time that can be proportionate to the cost of the system, to make sure that we are getting them the best benefit for what they are purchasing our system for.
Interview I had done with one of our Epic analysts, and specifically observed that while they do think our software that we talked about is feasible, they weren't really completely familiar with current pathways for integration of third-party software, although we do have precedents at our hospital. The current focus is on tools that rely on smart phrases, which aren't necessarily personalized. and that physicians do, however, directly communicate with patients through my chart or document their phone discussions in triage and counter notes. But we learned that even the clinical informatics staff are detached from daily clinical practice, and the impact that inefficiencies in the electronic health records can have on a physician's well-being and ability to effectively provide patient care.
Our group decision is no-go. Based on the advice from 5 subject matter experts, 2 chief medical information officers, 1 virtual health medical director, and 2 highly respected academic advisors, 4 MDs and 1 PhD. Our group has decided not to proceed with our original proposal using artificial intelligence or AI assisted technology to provide patient lab follow-up. Our original proposal addressed a clear provider pain point. However, we determined our proposal was not feasible. AI technology has not progressed enough to provide independent clinical assessment and guidance. We also concluded that our original proposal was not viable, as our financial estimates were off target by a factor of 10. Given these limitations, we decided to pivot our direction towards a more attainable goal: improve human best practices using currently available AI technology to screen, review, and communicate lab results.
As John said, we're not moving forward at this time. However, we have laid out next steps for what we might do if we were to come back to this technology in the future. We know the desirability is there for providers and patients. And then for the feasibility, we know that there is a feasibility around improving that lab follow-up process using human and AI technology. However, the AI may just not be there at this time. We know we want to still confirm the demand and financial support on a viable level to ensure that there would be enough interest and investment in order for us to continue to develop the product, and then once it is developed, have a demand in the market for such a product. We need to continue to test and reevaluate, conducting a lot more interviews to make sure that we have a full picture of understanding of what the current process looks like for providers, how aggravating it is in terms of their buildup of their inbox, and that we are putting out a product that would actually help correct this issue. And finally, we need to really prepare a technology transfer strategy, defining roles and responsibilities, getting our patent rights in line, and then also if we want to roll out this technology as a one-off product for a company or move forward with more of a licensing agreement type arrangement in the future.